Mandera on the 6th, which was the Saturday of this month. And on 8th, the counties started going to receive them from the regional stores. 8th and 9th. 23 counties started vaccinating last Wednesday. That's when they began. Wednesday, Thursday, and Friday, they did 9,000. Our deployment plan targets 1.25 million frontline health workers up to June. So if you take 3 days and you have 9,000 and your conclusion is hesitancy, some science doesn't add up there. And by the way, I'm not worried. I can assure you from this week, what we've done is that this week we are onboarding the private sector hospitals, the mission hospitals. We are expanding to 600. And we are doing it as a due process. We are looking at quality. We are not rushing anything. The context of this country is that the regulator also has set certain conditions we must meet. Chief among them is to monitor for side effects. A very clear process that has to be reported to the regulator, the Pharmacy and Poisons Board. That's number one. And the second context is that Kenya is a devolved health system. We cannot be the ones doing the vaccinations in the counties. So we spent most of last week really getting to the same page with the governors and the county leadership. The hospital 622, the counties themselves have selected them. So, and I can tell you today before I left, I can see we are ramping up the numbers. Last week we could say 3,000 a day. Monday I saw we are 4. Today I saw us heading to 5,000 per day.
Can you confirm, Doctor, that all 47 counties have the vaccine?
All the 47 counties, actually by last Friday, 43 counties were already vaccinating. By this week on Tuesday, all the 47 counties are vaccinating and reporting it to the digital platform.
All right, Doctor, you talked about side effects, and I'm going to talk about that in a moment with Dr. Gikonyo. Dr. Gikonyo, let me ask you real quick. You're a frontline worker. You're one of the most famous frontline workers we know, yet you haven't been vaccinated yet.
That's correct.
What's wrong? What's happening?
That's also true. No, Jeff, first of all, let me commend the Minister of Health with what they have done. The numbers that we know show a lot of effort, especially because, as you're aware, many people may be a bit skeptical about getting the vaccine, and it's our job and duty to encourage people to access this vaccine, especially people at high risk. It's true, yes, I've not been vaccinated, but Jeff, let me tell you, let you into my secret. I'm not running to the front line because, like a few other of my friends, I've had my own exposure of the COVID infection. And I feel that although we know that it's not a permanent immunity, you still need the vaccine. Those of us who have had the virus should give a little bit time for the people who haven't had it, even to have it. But however, as you have heard from the Minister of Health, the private hospitals are yet to get the vaccine until maybe next week. And I can tell you, once we get it, I'll be one of the few to get that vaccine. For the time being, what we are doing at the current hospital, we are liaising with the government hospitals, Bagathi, Kenyatta National Hospital, and sending some of our staff there to get the vaccine.
All right, Dr. Willis Akwale mentioned side effects, and there have been. I mean, especially what we're hearing, like 20 European countries have suspended the use of the Oxford AstraZeneca. Many claiming that there are side effects. Dr. Willis Akwale said they want to monitor and see the side effects. Well, are you concerned about that?
Oh yes, we are like any other new medication. We are concerned and we must monitor for side effects. We must be careful that we do not exaggerate the side effects, because there are events that will occur at the time of immunization that would have occurred either way, and we don't have to associate them with the vaccine. But like any foreign protein that is injected into people, there could be reactions. But let me tell you, in Europe, they can say they are not going to use this vaccine or that vaccine because they have the privilege of using other vaccines. Remember, in this country, as far as up to the present day, we only have the AstraZeneca vaccine. If you don't use that which you have, you don't have another choice. If you live in Europe and you can get the Pfizer or the Moderna or the Johnson Johnsons, yes, you have a choice. But we cannot suspend the only thing we have when we don't have any other alternative. The side effects are there. They are not major, but it's true they are there and we need to monitor them. But there's in the people who require it, and let me stress here, Jeff, what we need is to know who needs the vaccine. And there are people at high risk. Overall, in the whole world, the mortality rate of, in common language, the death rate from COVID, on average is 2 to 3%. In very young children, it is as low as 0.1%. In the elderly, 65 plus, who have other comorbidities, the mortality can go up to 10%. So it is that group that we must identify and say these people are the ones who have the highest priority, even if they're not frontline health workers. If you have diabetes, you have a 75, you live in Nairobi, you have cancer, you have high blood pressure, you have heart failure, you are obese, especially obesity is a major risk factor, you should be classified as the high-risk people amongst the frontline workers. If you are a frontline worker and you don't have many of those comorbidities, you are at less risk than the people I've described. So those people who have those risk factors, despite the small risk of reacting to this foreign protein, please, you must get that vaccine.
All right, Doctor, hold that thought. I'm going to go from Karen all the way to Kansas, make that Wichita, Kansas, where you find Dr. Job Mogire at the University of Kansas. Good to see you, sir. Look, it looks like you are at ground zero of this pandemic. More than 500,000 deaths where you are. It must be scary working in that front line.
Jeff, you're right. It was very scary. I remember the initial days when we started seeing a few of the first cases, how the environment in the hospital changed, how literally everyone became tensed up. Conversations became taut and short. And I could see colleagues and nurses and all workers in the hospital getting overwhelmed, especially when we came to the peak of the virus. But thankfully, that's behind us. We have just come out of winter, which we had suspected was going to be really bad, but it didn't turn out to be as bad as it was. And perhaps the experience of going through the worst crisis in terms of the COVID outbreak continues to influence the attitude that majority of the people in this country have towards the vaccines that are now available.
Tell me something, Dr. Mogire. Were you asking yourself at one point, what am I doing here? What am I doing in this? I should go back home. Were you asking yourself?
Of course. It's a home. I have worked in other places, and every time I come home, I feel I feel at home, and that's why I've kept in touch with what's going on in the country about the prevalence of the virus, the new cases, the trends, and I know that right now we are seeing what might be a surge. I've been very, very much in touch with what's going on with regards to the introduction of particularly the AstraZeneca virus. I have been in touch with how the price of a packet of gloves went from 50 shillings to 2,500 shillings. And so, yes, I miss home, and I'm here to get skills. So hopefully I can come home and be part of the team that is helping our people deal with illness.
Absolutely, that's a good thing to know. One more thing, have you been vaccinated, Dr. Mogire?
Yes, I have. So in the institution I work in, bought the vials of vaccine, so I have gotten the 2 shots of that vaccine already.
How do you feel?
Not any different. In fact, I feel more confident now going into the hospital, knowing that I am protected, but that I also have a lower risk of transmitting the virus to my patients, especially because we see a ton of elderly patients in the hospital. Like right now, during my shift in the morning, I'm seeing a ton of very elderly patients who are the most vulnerable if they have the virus, and to whom I need to be as confident in my own immunity and also have a clear conscience that I know that I'm going to be transmitting this to them. So I feel great at this point.
Great. Hold that thought, Doctor. We'll come back to you in a moment. Let's come back to the studio. Dr. Willis Akwale, have you been vaccinated?
I got my first dose of AstraZeneca Covishield. I got a message with the batch number. That is very important because that is what is used to track in case there would be any side effects. And I got a message telling me I go back on the 8th of May for my second shot.
How did it feel, by the way?
First, to me, it is almost painless. But on the second day, I felt a little bit of the arm being heavy, and then it went. And from that, I feel like as fit as a fiddle.
Fit as a fiddle. Good to know. You made a statement at today's press conference earlier on with the Cabinet Secretary. You said in some hospitals, or rather some hospitals are using this vaccine to vaccinate their own people, their own nurses and staff and everything. You mentioned that, didn't you?
I mentioned that because we started getting information that some hospitals thought the vaccines that were given to them was for their staff only. The truth of the matter is that all the facilities that have been identified are identified as vaccination posts, and theirs is to vaccinate every category that has been identified as a priority group. So what it means, therefore, for example, Kenyatta National Hospital, we should see teachers going to get vaccinated there. We should see other healthcare workers, Nairobi hospital staff going there. And our icon, Dr. Gikonya, said some of staff have been going to the other hospital. He will be getting his vaccines at Karen, and he will serve that area, including even policemen, teachers. Anybody will go. They all need to identify themselves. They need to give their numbers, and they should be served. So I know there was anxiety that the vaccines are not there. We have enough. We are just managing the supply chain management. And as more and more people come and you use, we monitor, you will get your replenishment. We have 1.02, and we even got a donation from India of 100,000 doses recently. So, and I believe those doses are enough for the 1.2 million. Our next consignment is due the first week of April, and we will use that mainly for the second doses. But if you had Cabinet Secretary Mutahi Kagwe today said, when we get that consignment, we are bringing in front of the queue the elderly, the 60 plus with more comorbidities that Dan Gikonya has said. We want to start vaccinating them because they are a priority. Yeah. Again, today we had a meeting with the Interfaith Council, and we realized, yes, the clergy are always in touch with a lot of people, so they'll also get vaccinated.
That's good to know. The other thing that you mentioned, governors. Governors kind of jumped the queue, didn't they?
Yes, last week we had a meeting with governors. Of course, they are very supportive of this process. They released a statement supporting the vaccination, and during the discussions, they said they want to lead by example. They said, you know, health is devolved and they're in charge of health. So they view themselves as health workers within the counties. And they told us, you will see us getting vaccinated. And yes, I've seen so many get vaccinated, which to us is a good thing, you know. You are 47 governors, 2 doses each is 94 doses. It is not a big dent, and it is very good for advocacy and ensuring people get confidence. At this point, that is what we need. We need people to realize that this is a vaccine that is safe. The leaders are taking it. However, let me also state that you know, the vaccines are not readily available. There is a big global shortage. Even if you have money now, you don't get this. The COVAX mechanism has booked almost all the manufacturing. So you have to prioritize. And the plan and the policy was to get frontline health workers first. So it's also prudent, because I know some of our leaders have said we will come onto the queue when we are called. And that is also a very good principle.
All right, let me go back to Dr. Dan Gikonya right here. Dr. Dan, there's reports that Nairobi hospitals in general are overstretched. How is it at Karen Hospital right now?
No, that statement, Jeff, is completely correct. We are overstretched, even here at Karen. We have issues with the space for people with COVID, because there's a new wave that has come. This third wave has come in the last maybe 10 days. And it's quite severe, and so many people have been affected. And it's true, many hospitals in Nairobi are running short of space. And this is where a vaccine would help, Jeff, because what the vaccine does is that it exposes you to a small dose that the body can manage. And then the body learns how to fight this infection. So even if you're infected, you are pre-warned, so the body is ready. The reason we are having a lot of mortality from COVID is mainly because many people are waiting too long before they seek medical help. Because it starts like just an ordinary flu with a little bit muscle ache, everybody finds an excuse. Oh, it's a common cold, it's because I slept badly. And they wait 10, 12 days before they seek help. And by that time, the inflammatory response in the body has damaged not only the lungs, but the blood vessels. Our experience here at the Karen is that if we catch somebody early, when they're just developing early symptoms, and you put them on strong anti-inflammatory medications and antivirus, the response is good. The problem is when they come late. So the vaccine makes your body aware that if this were to come, I'm ready. And therefore that early phase is taken care of. Even the rest of the world, the data, Jeff, is that the value of the vaccine is in preventing severe and fatal disease. People who get vaccinated could still get sick, but they don't progress to the severity that we are seeing in the immune people with the high risk factors of being overweight, having comorbidities like we have mentioned, heart disease, diabetes, hypertension, lung disease, cigarette smoking, and such. So the vaccine does help a lot in controlling severity of disease.
Dr.
However, we know that this virus,
Let me ask you this real quick. You've heard of, you're talking about the vaccine, and there's a lot of myths, misconceptions, stereotypes. Have people been asking you personally, hey, doctor, should I take this? I don't really feel comfortable with this. Have they been asking you?
Jeff, I get 4 or 5 calls of that nature every day from my friends, from my colleagues, from important people. They want to know, should I take it? And the answer is very simple. If you have the risk factors, the answer is yes. If you don't have the risk factors, you're young, you're athletic, you don't have comorbidities, please don't take this vaccine now, because let us give it to the people who really need it. Because if I take it and there are not enough doses, I'm denying somebody who really needs it more than I do. So let us target the people who really need this vaccine and make sure they're covered.
Absolutely. From Karen, let's go back to Kansas City, and Dr. Job Mogire joining us there from the University of Kansas. The uptake of the vaccine, Dr. Mogire, is it impacting on the infection rate there?
To an extent, we are beginning to see a significant change in terms of the trends of the outbreak, but it might still be quite early to see changes that are significant enough to attribute to the uptake of the vaccine. And that's because the majority of the people taking up the vaccine are not part of this segment of the population that is suffering from vaccine hesitancy. In other words, this would be the same people who are embracing social distancing, wearing masks, and practicing meticulous personal hygiene, reducing their personal risk and even protecting their own family. Therefore, it's likely to take a couple of months for us to get data that convincingly shows us that the uptake of the vaccine has influenced the trajectory of this pandemic and in which direction for the local population that we are serving here.
Tell me, speaking of hesitancy, Dr. Mogire, there are quite a large section of Americans who say they're not going to take it. They're not going to take any vaccine. You still have that there.
That's right. That's right, and it's not unique. What we have to do is to think of all the viral outbreaks we have had through the years, and it would explain what is currently happening. When HIV broke out in 1980s, 1984, 85, 86, we were where we are today, where media and all sorts of conversations were ridden with a lot of misconceptions and conspiracies. So unfortunately, that's essentially where we are today. For example, one misconception is that when you get the coronavirus vaccine, that you are getting the virus, a lower form of the virus. No, you are not getting the virus. Think of the coronavirus like you have that uncle of yours who is very nasty and he drinks a lot and comes and makes noise, but he wears a red cape. So what the vaccine is doing is to give you eyes in your body to recognize the red cape, so that when you see the red cape coming, you close the door. That's what your body is doing. Your body is being taught to recognize the coronavirus. What you are receiving in the vaccine is not the coronavirus vaccine. You are receiving a protein which your body, a part of the mRNA, that's a nucleic acid, which your body will use to produce what will fight the coronavirus when it comes. So you are not receiving coronavirus in any form. Your body is being taught to recognize that uncle. By the time he comes, at least you will be prepared for him. The likelihood that he will stress you and waste your time will be minimized.
Dr. Mugire, how did you know about my uncle?
I haven't heard that.
On that thought, we're going to get back to you in a moment. From Kansas City, Dr. Mugire, all the way to Karen Hospital, Dr. Dan Gekonya, and here live in the studio, Dr. Willis Akwale. Folks, we're having a candid conversation on the vaccines. What are your questions? What are your concerns? Keep tweeting at Koinange Jeff, at Citizen TV Kenya, the hashtag JKLIVE. They're making me work out today, aren't they? My goodness. Let's take a break. We'll be back in a moment. What?
You're watching